Welcome back. Some of you have heard about Dr. Amina Ogbachi. She is a sickler and also has a kidney problem. She's in need of both kidneys and bone marrow transplant. Dr. Amina, a graduate of the College of Medicine, Lagos University Teaching Hospital, Idiaraba, Dental, is doing her housemanship presently with Lasut Ikeja, and she's presently undergoing dialysis at Lagos State Teaching Hospital, Ikeja, Lagos. We are hereby soliciting for your support to save this young, promising, innocent lady. We have here with us a medical team. They're looking for about 10 million naira, I believe, to put together so she can go, I think, to India, correct?
Yes.
To do this surgery. Now, this is a very, very dire situation because she's an AS, I read, and also she's a sickle cell, and also has the kidney issue. So there's like a double jeopardy kind of thing, and we really need to. And this is somebody that was very, very active in Lasut. She's a doctor. She's very popular in doctor. I mean, I've been seeing this all over Twitter, Facebook, and Instagram. Everybody's putting everything together to help support her. So Yourview also, we're very passionate about women, and we felt it was key for us to invite you over to tell us a little bit about her situation. With us, we have your name again, sir?
My name is Babatunde Ogushuba.
Mr. Babatunde Ogushuba, thank you so much for coming. Appreciate you being here.
Thank you.
All right, so as I said, we've been hearing about the story. Has almost gone viral. It's on Twitter. It's all over, and you kind of hounded me on Twitter several times, and I was like, okay, we don't usually do this kind of things, but you know, I had to think about it for a second. Okay, maybe ladies of Yourview were interested in women and encourage. We want to be that help, that support for a lot of women, and we thought it was key for us to bring you on to come and tell us a little bit about. So, could you just give us a bit of a background on how you even met her and how you're involved in this?
Okay, Dr. Amina, we've never met before the whole situation started, but she happens to be like a friend to my brother, who happens to be a medical doctor. You know, he was just discussing with me that there's this lady, you know, I'm an IT person, you know, and I do more of social media stuff like that, and he was just like, and we just have to help her to raise this fund. Getting to the house that very day, looking at this innocent, promising lady, you know, I was just like, wow, is this life? Is this country, you know? I just like, wow, the only thing I can do is just to use my own profession and to assist her in every area that I know it's possible, by all means. And that was what led to...
When last did you see Dr. Amina?
Last night. We were together last night up till to 11 there, about like maybe in 10:55
Is she in hospital?
No, but you know, she resides in the Lasut because she's doing her housemanship, and the Lasut management have been supportive with the dialysis, you know. So once she goes for her dialysis, she have to come back to her room, which her mother, because she has actually lost her dad.
Okay.
Yeah.
I know dialysis is quite expensive. How is it subsidized for her at Lasut? Is there any?
Yeah, initially, no, but the management have come into that, which they've waived that already, and they've been supportive on that aspect. But you know, the more it's been delayed for the transplant, you know, because of her.
I know for kidney now. Is it that she has already a matching?
She has a donor.
Okay, she has a donor already.
Yeah.
Okay, so how much have the team has been able to gather, you know, so far?
Okay, that's her picture.
Yeah.
Okay. Basically, you know, we have we have like committee of friends abroad as well. They are raising funds, you know, that if you trend it, you can get that. Basically, for now, I think what I'm sure of.
You don't have a figure. You don't have a figure.
Yeah, I can't really say.
How much?
Yeah,
Okay.
but as of the last time we saw, I think it's around 1.8 thereabouts.
Okay, now what exactly is this money needed for? Could you explain to us in detail?
Okay. The details, what the money will be needing for is one, the transplant itself, and because they have to go through diagnosis before, series of tests before the transplant, like cross-matching test and the whole stuff like that, which we know because of the country that we find ourselves, it's quite expensive. And after the cross-matching, you have to go for the transplant, and not even the transplant that is that expensive. You know, it is the post-transplant, because one, the drug, the first year drug has to be in stock before you can even say anything. So imagine the cycle side of it, the monetary aspect of it, they just have to. So the monies that we're soliciting for is going to be using for the transplant.
Okay,
and
so
for
is
the
she going to
post-plant.
India for this, or is Nigeria going to be done in Nigeria?
Yeah, basically we've gotten a quotation from India, and we have different countries that we're suggesting. Some of the friends are suggesting US, some are suggesting
Is it
UK.
possible to have it done here? Because I know that one hospital tried it some time ago, and they were able to successfully do it. Being a teaching hospital where she's from,
and
they be able
Lagos
to try
has a dialysis center here in Bagada.
Yes.
Yes.
Whoa.
Yeah,
So why
that's-
can't it be done here?
Basically,
You're not sure.
I'm not going to say,
You don't trust-
I'm not saying I don't trust. We have very, very
Competent
good and competent hands that can do it here. But, you know, I've been to India before, and I've seen, I have series of people that have done it before, and which I even have one here, a close friend of mine, you know. But I can only testify to what I've seen and what I've witnessed.
What I hear of India, in all honesty, what I hear about India is when you go there, people are on the floor, too many patients, too little beds.
Yeah.
That's what I hear. I've
Okay.
never been there.
So
I'm wondering, is India really better than Nigeria?
Okay, I think I stayed there for more than...
The hospital or?
Yeah, in and out of the hospital, more than 4 to 5 months.
What, you were
there.
ill?
No, my brother. And the hospital is even far better than our 5-star hotel here in Nigeria. I mean, they are medical. I'm not saying outside the hospital you can tell me any other thing, but they are medical.
But it was a
aspect
private
in there.
clinic, I'm sure.
Not private.
Why
Yeah,
does it
you know, Indian private and government always come
All right,
together to do
so that we
something.
don't spend too much time
Well, I
on this.
wanted
But
to
I
ask
think
a question. What time frame do we have right now to raise this money? Because if you're doing bone marrow transplant, you're doing kidney, that's not small surgery. I mean, those two are very delicate surgery. I know the bone marrow is because of her sickle cell state. So what time frame do you have for, you know, for the from now till the time that the surgery has to be done? This is like a deadline.
Okay, because some minutes before we came on set, I was discussing with my brother what's her situation there, and presently she's even bleeding. So that's to tell you that it's something that if anybody wants to come to our rescue, is that you come now and now and now, just as quick as you can.
okay. All right. So we do have a account number. I think we're paying directly into her account.
Yes.
That's Amina Ogbachi Shobodu. We will also text it on if our producer can get that information. Amina Ogbachi Shobodu, and it's the GTB account.
Yes.
And it's 001-439-7186, and we'll tweet it online also, so you can have it 001-439-7186. And we'll tweet the details of the account number, and no amount is so small, whatever you can do just to help her. Because even this haunted me. I mean, as I said, I've heard about this for about a couple of weeks. I wasn't sure how to approach it because we don't usually do this kind of public announcement on TV. It's actually against our policy, but I kept getting bombardment from text messages from different sources, different places. I'm like, okay, maybe I should actually do something about it. So I spoke to my boss, and he then said, okay, I'm bringing him on. So it's not something we usually do. So just tomorrow, don't come and tell me somebody needs something. It just is a one-off thing. But we do apologize. We do thank you for coming on the show. We do apologize. And we hope that Dr. Amina gets well soon. All right? We're going to take a quick break now. When we return, still talking about health. We'll talk about health insurance, because if there was health insurance, maybe Dr. Amina will not be where she is, because we would have found a way to actually treat her and won't be soliciting for funds. So we're going to talk about health insurance, and we'll be right back. Thank you.
Thank you.
Welcome back. Now, still talking about health insurance. is insurance coverage that covers the cost of an insured individual's medical and surgical expenses, and considering the fact that better healthcare is one basic human need that everyone craves for, the federal government established the National Health Insurance Scheme with the objective of providing universal health coverage for Nigerians. Now, joining us on the show to shed more light on this is the head of the Risk Management KBI Health Insurance, Dr. Adeolu Ogundeji. Welcome to the show, sir.
Ogundeji.
Ogundeji, I do apologize. Welcome to the show, sir. You can call us on 070-8066-8014. You can tweet to us at TVC_ENT and hashtag Yourview. Now, you heard us talk about Dr. Amina for a second. And
yeah, sure.
Generally, insurance scheme is something that is not very, very popular around this area. There's the private insurance, which I know you're part of, and there's the national insurance.
Yeah.
Now, generally, first of all, for those that don't even know what an insurance is, let's start with what an insurance is and how you can actually be a part of an insurance scheme. Then I would like, I know you may not be versed in that, but I would like you to talk on that national health insurance and what exactly where we are on that.
Okay. Thank you, Moriah. For health insurance, it's just the two words, the F and the insurance. The basic essence is for everybody to pay for the few that will be sick. It's assumed that not everybody will be sick at the same time.
Sure.
Therefore, if everybody can come together and probably pay a token, that token will be big enough to pay for the few that will be sick. We are all here, we are talking about Dr. Amina. How much does she need? 10 million. How many are we in Lagos? If all of us decide to drop just 1 naira each, I'm sure it's going to be more than 10 million naira. And then Dr. Amina will have been sorted out. All of us will have been happy. But convincing people to come together to do this has been the challenge. And we all see that this is just the way forward for us as a nation. It's been done severally abroad, and we've seen the result. So we don't have an option than just to embrace it as a country, as a nation, and as a people.
What do you know about the National Health Insurance Scheme? Because we've been hearing about this for a long time. Why is it so hard to... I mean, I know it exists,
yeah.
But the thing is about how come a lot of people are not covered, are still not covered?
Yeah, that's actually the big question. But National Health Insurance Scheme is actually the regulator of the health insurance in Nigeria.
Okay.
We have HMOs, that's Health Maintenance Organization. These are the ones like the engine room that push, that make this to work. Okay. Through the providers, these are what we call the hospitals. Okay. These are what we call the clinics. For the health insurance, why is everybody not on it? We have only a few people. Less than 6% of Nigeria are actually covered as we are speaking today. And it's because of level of literacy as a nation and our perceived belief that I won't be sick. I won't need to pay for health. However, you don't need to be sick before you visit the hospital. All of us were born, whether through surgery, whether through normal delivery. These are reasons to go to the hospital. And these are reasons why we need to dip our hand to the pocket to pay money. We are saying that let us stop this out-of-pocket payments. Pay just token, and if it happens that you are here, you will go ahead and receive care.
This token that you are saying that we should pay, we pay it to who, and what is the guarantee? Because I know that in my grandmother, she worked in England for a long time.
Okay.
When she went back to England after many years, she was paying tax. As a taxpayer, she was entitled to Social Security. Yeah. They're looking after her now. She's in hospital. They're looking after everything is paid for by the government because she paid tax. But what is the guarantee? Because we pay tax here, and I don't know that there's any guarantee that the government is going to look for me, look after me.
Pension self, you'll be lining up for 20 years just to collect your pension.
In my old age. So what is the guarantee that this one, you do it now, somebody will not abscond with the money? Then you'll be looking, hey, where is this lagbaja that
when you are 60.
If we continue to say because there is no guarantee, we will not start, then we'll never do anything. We need to believe in our system. Unfortunately, we are talking about change now. With the change that we are all talking about, let us believe and know that the change has come. Some of us have been enjoying health insurance for years. Not because I'm working there, but even for the other people that are not working, I'm sure that probably 1 or 2 of us that are around will have had experience of health insurance.
Let me come to Uwa.
Okay. I wanted to ask a question because it's in line with what YK is saying. I have a problem with, for instance, even normal car insurance. your car gets accidented and it did not start to speak long grammar. How accessible, if, for instance, I subscribe to this health insurance thing, and tomorrow maybe for some reason I fall in and I'm in need of a huge chunk of money, maybe like this 10 million naira that Dr. Amina is asking for. A lot of people, you know, a lot of these insurance companies, before you would access that money, you know, but maybe by then you would have gone 6 feet under.
You will die before they give you the money.
No, that's your perception. Let him
clarify. How easy is it accessible?
It's our perception. So
it is actually very accessible. However, most of us need to be well informed. When we talk about health insurance, what are you covered for? We need to know what we are covered for. If you are not covered for a particular illness, and that illness now come up, there is no way you are going to be covered.
That's why I have a problem. Let me quickly say something.
So when you are paying,
I'm aware of the NHIS and how it works.
Okay.
Now, when you you start with the federal government workers and they took this percentage from their salaries, everybody subscribed to it. But they found out that when you go to the hospital, they will tell you are covered for certain illnesses and not for others. Let it be clear. Why can't you just make it you know, transparent, where somebody knows that okay, it's 40% of the cost that I'm bearing? Because later, a friend of mine had to undergo surgery for fibroid, and she had to do an arrangement of 60-40. Do you understand? Some people who are under the NHIS have complained relentlessly about the kind of treatment they get, because when it gets to drugs, they can only afford to give them basic drugs like paracetamol, vitamin C, and all that.
Imagine. So
the most expensive of the drugs for an hypertensive person, for instance, they would not, you know, cover under the NHIS. So I think there's a lot of, you know, mago under the NHIS. I have seen health insurance that has worked. My father is a beneficiary of an health insurance put in place when he was working in a particular corporation in Nigeria today, and they still benefit from it till their old age, himself and my mom. So it works. If you can work for some people, I think corruption is involved in NHIS.
And then,
well, let you respond to that.
Okay.
I may not be able to actually defend NHIS or say whether it's true or not, because I don't work there.
Yeah.
But I know that when it comes to the premium that you are paying, this is the money that you pay for the health. There is usually an attached benefit list that these are the things that you are covered for. Okay. But in Nigeria, what we do is let's just pay and believe that everything is covered. It is not. That's the same thing with the issue of the car. When you pay premium for the coverage of your car, whether it's comprehensive, whether it's third party, we have a list of what is covered. For example, let me ask you, the conditions attached to the premium you paid for your car, do you know it?
No, I didn't even bother.
That is it. And you signed it. And you signed it. It's actually there.
I didn't even bother.
We know the
that
premium,
is the thing.
Oga.
So the point is that Nigerians
need to know what we are paying for.
I
that
know,
is where we can
I know a premium on car insurance, but YK, when you pay a premium on car insurance and somebody hits you, the insurance company will start asking you so many questions, you know, that, I mean, it wasn't part of the plan. Why don't you just pay the money? At least I have paid premium for you to fix my car. Do you understand? If I decide not to fight on the road like a tout to hold the person that bashed me, it doesn't mean that I'm not entitled to the insurance. That is what I'm saying. And a lot of insurance companies, they just, you know, they say it now. Then time for you to now lay claims or whatever it is that you need, they start to speak big grammar. That is the only issue I have. And then this one that they're saying you're only covered for certain illnesses. You are not God, so you don't know what illness can come.
Even God, now your grandma that is in London. There are various stages.
Do you know what she's in hospital for?
You decide. You see, they give you the options.
Do you know what she's in hospital for?
Things like cancer, diabetes is covered. XYZ is not covered. You can now pray.
She's in hospital for dementia. I'm sure that she didn't know she would ever get dementia.
That's unforeseeable. That one is totally unforeseeable. Now let me explain something. Muslim. Why a lot of Muslims are against insurance is because of this, you know, dark gray areas in insurance policies. As a Muslim, when you want to go into any transaction, Islamic transactions, everything must be clear. It's clear. Now, let me break it down for what I mean by everything must be clear. If I'm paying a percentage of, let's say I'm paying 20 naira for a particular business, and you say, you pay this XYZ money, you don't know whether you'll be ill. So I'll pay it for a long time, and I won't get the benefit of it if I never fall sick.
Yes.
That money goes to the insurance company.
Yes.
That is a fraud transaction under the Islamic transactions, and nobody should go for it. Now, if I pay 20 naira during a period of time, and at a particular period of time, I don't even fall sick, but I want to take benefits of what I have paid, maybe to even assist somebody, and that opportunity is available. You tell me that it covers you anytime you fall sick because you paid so amount of money, maybe for 10 years, and you've never had to use it, but now you want to use it at any time. You don't tell me, no, it doesn't cover you for this, it covers you for those gray areas. Those are the issues that we have.
Okay,
maybe people should look at.
Let me go to the issue of gray areas, because now I want you to be the one doing the talking, not us anymore. I want you to respond. Now, are there customized plans for the Nigerian society? Because we have people like house helps, drivers working with us, the people that are so, they help that you go to insurance company, they say, oh, only husband, father, children. And you have grandma 1, grandma 2, or grandpa 1 staying in the house, you have house girl 1, house girl 2, and they all need to be covered. Are there customized plans for this extended family? Because always mother, family, mother, father, children. Exactly.
There are various forms of health coverage with respect to health insurance. What she appeared to be talking about is what we call the formal sector. These are the people that work in government facilities, people that work in the ministries. We have another one that covers the corporate entities. We have another one that covers the family. I can decide that myself, my wife, and my children, they are going to be covered under this benefit. We have packages. It could be the lowest benefit that you want to buy, or the one after that, or the one that is highest. The choice is yours. And as you move on that, the premium increases. So you are actually the one determining what you want. For some other HMO, to answer your question on the issue of the customization, for some other HMOs, like my HMO, we have customization on our plan. So you can actually sit with us and tell us that these are the list of benefits you want.
You not pay through your nose.
You don't need to pay through your nose.
Okay, let me take
what you're going to pay is so small compared with what you
Let me take a Moto Abis call.
Good morning.
Good morning, Moto. Please go ahead.
Yeah, I'm a first-time caller.
Yay! Come to the show.
Yes, this is a very nice program. I certainly enjoy your program. Myself, my wife, we became addicted to your program.
Thank
you very much for doing this program.
Thank
you. To my point about the insurance, I'm the type of person that I get everything insured around me. My car, my wife car, my house. But in this health insurance, I think they need to give more awareness, because I'm still asking myself, why am I not having health insurance? Because I don't have enough information about it. So they need to give us more information, orientate us about it, tell us what they want to do. In terms of claims, all the insurance I've made, I don't want to mention my insurance company, all the insurance I've made, every time I have any problem, I get my claims promptly.
Okay,
no problem about
fantastic. Thank you so much, sir. Talking about education, I want you to touch on insurance, especially with the various policies, because the truth is that, as somebody has already said here, people don't get sick really until maybe you start approaching your 50s. There's that time you have high blood pressure, there'll be issue of diabetes, there'll be issue of cancer. Now those are like really, really serious. Now we have Dr. Amina here has kidney issues. So these are problems that occur at some point. Now these insurance companies, the guarantee she was talking about, are they guaranteed to cover us in those kind of illnesses or diseases? Because what we hear is your regular paracetamol and this is not covered, the big things are not covered, but the small ones of regular malaria and the fever.
Then will not come out and give you big money.
That one I can pay with my eyes closed. But the ones where I really need health insurance, they start telling me stories.
Because I can go to this chemist and buy paracetamol by myself.
Okay.
I don't need insurance for that.
Okay. For the issue of coverage, like I said, you are the one determining what you want to get covered for. Is a package. You can pick level 1, you can pick the highest level. And when you decide to buy level 1 and you now get healed and you need level 10, you know that you are the one that decided it was level 1 that you wanted.
That's not fair.
And then in terms of when you are old, probably 40s, 50s, premium that is paid is annual. So when you are covered for a certain period, usually 1 year, you are covered. You can renew it at the end of the 1 year.
Okay, that level 10, how much will it be?
It depends on the HMO.
Let me take Kayode's call, sir. Let me take Kayode, are you there? I'm sorry, I kept you on for too long.
Can I ask the question? Because you see, now I know that if I want to get an insurance policy, they will check my medical history. They will check that, okay, my age, they check my medical history, they check a lot of things. They know that, okay, this one might not be problematic. Then they give me a particular fee to pay. But for someone that's a sickler or someone that is diabetic, you know, I am sure there are different amounts of money, and they measure it with your age. So it tells me that the premium I might pay, you know, might
certain,
yes, would be higher. So because you're already anticipating that this person might need this in the future. Correct me if I'm wrong.
The answer is yes and no.
Okay, answer me.
If you are talking about where we have the pool, either under community health insurance or under a corporate entity, whether you are a sickler, whether you are hypertensive, whether you are diabetic, it doesn't count. You will pay the same amount as another person that does not have that particular challenge.
Okay.
Yes.
Okay.
However, when there is no pool, you are coming alone. That is when some conditions will be there. And when you look at those conditions in terms of, okay, are you pregnant or you are not pregnant? Are you having this condition or you are not having this condition?
Let me take this call, sir. Engineer Bumi from Otta. Oh, I'm sorry. I was giving them for too long. I do apologize, Engineer Bumi.
Please finish.
Please go ahead.
Okay. So when you don't have those pool, that is when you pay a little higher. And that little is usually lower than what is expected that you pay out of your pockets when the need arises. However, because of the level of coverage that we have currently, which one of your callers was talking about, and he said he doesn't even know about it, but he insured his car, he insured the houses. But what of the occupants of the house? They are not insured. And we are insuring the house. We are insuring the cars. So we need to get our priority right as a nation. We need to take human life to be so important.
Let me give you an example. Okay. The easiest insurance for any average Nigerian is, okay, I pay 10 naira or whatever amount I can afford based on my salary. So I earn 10,000 naira a month, right? And I can afford 1,000 naira to pay, regardless of whatever I pay. She earns 100,000 naira and she pays 10,000. At the point both of us have cancer. Yeah. I rejected Jesus. Amen. At the point both of us have it, we should be able to have access to the same treatment. Not say because she paid 10,000 and me I pay 1,000, then you now say no, I can't be treated. You can't give you treatment. You can't treat you for cancer. You can only treat her for cancer. You just give you medication to cover up the cancer. You know, that's what we want to do. That regardless, can we be entitled to the same treatment when that need arises?
That's what he's saying. That if you pay for the level 10.
No. There are different. That was what I was saying. That there are different categories. Under what we call the formal sector, cancer is covered to a certain level, whether it is A or it is B.
I have a call from Nasarawa. I don't want to lose that call.
Okay.
Emo, are you there?
Yes.
Imo. Kumo. Sorry, Kumo.
Kumo.
Hi, is Nasarawa State?
Yeah, we are fine.
Very well. Please go ahead.
Yeah. Yes, I'm a first-time caller.
Yes, certainly.
Thank you. I commend you guys for doing this. And welcome to the doctor and good work. Please, I about this topic. The number one thing the insurance company should know is that Nigerians generally, apart from being informed on so many things that are actually our rights, people are actually careless. I mean, people don't care much about what is my right, what is not my right, what is this, what is that. But the most important thing is on the part of the insurance companies, whether it...
I lost that call. So you're saying, before the call came in, you were saying something?
I was saying there are various packages, there are various...
Sorry,
let me remind you. No, wait, hold on. Because you know what you were saying. You see,
doctor, you don't confuse.
Sorry. No. Under corporate covering,
yes,
somebody that is paying 1,000 naira, obviously the person does not have a corporate covering. I'm a businesswoman, I'm a market woman, and I want to pay insurance so that in the event that I fall ill, I get insurance cover. Sure. You are saying something under corporate covering. What if the person is not under corporate covering?
No, that was what I'm saying. Corporate is just one. We have community health insurance. That's why you can go to my village. You can cover people that are not even enlightened.
Okay.
I have somebody right now, doctor.
Yes.
Are you doctor? Are you doctor?
I am.
Yeah, I have somebody right now close to me.
Okay.
Diagnosed of cancer, ovarian cancer.
Okay.
And she's somebody obviously that can't afford it. Somebody that obviously cannot afford it. Everybody has put money together from every source. And I told her, why don't you go to Lagos State government and see what they can do? She's been to LASUT. There's nobody to help her out. We're at the point where we're looking for money for chemotherapy.
Okay.
That kind of a person, what could she have done? So that even when she's asking people...
Can she even take an insurance policy now and people cover
yes. Is it possible for that kind of person to take an insurance policy at this time?
She cannot take it now. Let me explain it. Let me explain why. Your question is like asking that after I've had an accident with my car, can I buy an insurance so that you can fix the car? It is no longer an insurance. Insurance is expected to be a kind of payment that you make for eventuality that may happen, not when it has happened.
Dr.
But for the poorest of the poor, sorry, let me let you go.
Michelle,
pause. Let me have a call. Murphy, are you there?
Yeah, I'm there.
Sorry, I didn't want to lose your call. Go ahead, please.
Hello?
Yes, please go ahead.
Sorry.
Michelle, Godwin is saying on Twitter that Dr. Adeolu, what is the premium paid by those on the scheme? That is, what are the levels of premium?
That's what
for NHIS, 15,000 naira
a month.
No, per annum for the whole year.
For the whole year.
How much is that?
For private ones like you want, you run. And what's the level?
We don't care about private ones because that one can be.
That one is
they will give you beyond paracetamol. It covers as much as surgery. It covers delivery.
Or for the entire family.
Yeah, no, per life. Per
person. So if you have 4 children, it's 15,000 per child.
For the whole year.
For the whole year.
Why is it expiring? Okay,
NHIS is not accessible to everybody.
It is.
It is not, because I've tried to subscribe to NHIS, and at the time I tried, they said it was open to only federal government workers.
That was then.
So how accessible?
I'm telling you now that it is. It's available. You can check the website.
Oh, that's good news. So NHIS is available for everybody.
Yes.
So any Tom, Dick, and Harry now can just go to NHIS office and apply, pay 50,000 naira per month per person.
Yes.
Interesting.
Yes.
Cynthia, are you there?
That's not bad.
Yes.
Cynthia.
As long as it's
hello.
not
and
1 second, sir. Cynthia, are you there?
Good morning.
Good morning. Please go ahead.
What I want to contribute is so concerning this premium
insurance
package that he's talking about. Fine, you know, every other person will not be receiving the same amount of money that you now say, okay, I want to pay this at this time, I want to pay this at this time. I feel the insurance company should do it such that those that are paying for premium, maybe you can pay within a stretch of 10 years, another person can pay for premium within a stretch of 20 years. So you can equally get that benefit. It shouldn't be a flat rate.
I like that
you cannot
one.
miss up at this time, then you are not qualified to have that premium package. They can do it that somebody can pay
Cynthia.
10 years, another person 20 years.
That's a good idea.
That's a custom-made.
What she's actually talking about is almost what is being done currently.
Okay.
When you are a staff of the government parastatal, your salary is being, you are deducting just a little amount from your salary, and that covers you for the whole year. They deduct it monthly. By the time you retire, they are still going to be paying you pension. Small amount will continue to be deducted from your pension. So invariably, you are covered all through your lifetime.
Now,
by the
there's
time,
this tweet.
let it finish.
Please finish before I read the tweets.
By the time you've retired, your children are expected to have grown up. They will no longer be under you. They will have been on their own again, and their own children too will be covered. However, because of the number of people that we are covering currently, which is just less than 6%, what we need to aim at is how to increase this. The NHIS has planned that by end of this year, they will be covering up to 40%. We hope this sees light of the day.
Okay, all right. Tweets, please.
Because this is Guru J. Ademola. He says, I am a doctor, and even when I tried assessing the NHIS, I was disappointed. The whole scheme is a sham because it's not encompassing.
What does that
mean?
This
is a doctor.
You said it's a doctor. Does it? Oh, anyway, we won't be able to know whether he asked.
Omolaja Olatunji is saying, even though NHIS is not very efficient, I have helped workers in the formal sector, so who's fears are relevant.
Okay, now, for someone like me that have private insurance, HMO, with my company, can I still get an NHIS?
You can, but what do you need it for?
And just think, what if I lose my job? What if they fire me tomorrow?
Hey, wait till that time.
And I start looking for NHIS.
No, you don't need to look for them. They are beside you on your
my point is that if I get fired tomorrow, God forbid, reject in Jesus' name.
Amen.
And I'm out of work. So I'd rather pay now 50,000 so that I know that I'm covered.
No, it's something. It's not a fixed time that this is the only time that they sell the plan. No, it's something that if you cease to be an employee here today, you pick the other one tomorrow, and the waiting period is just about 30 days.
But apparently you can access it on our iPads.
Yes, it's available. Just check the NHS website.
Let's take a lot of
because apparently some people are very skeptical about this.
That is the
issue. Simi says most of the HMOs are fraud. I have a high prolactin and my hospital is Echo Hospital, and my HMO was forcing me to change hospital. His Grace Toba said, all they give you is paracetamol. Your guys should stop deceiving Nigerians. You guys should go do undercover journalism in their offices. Billy Kiss says, insurance companies are running a business and they need to make profit in order to sustain their business. And
I think what he has said is I don't focus on the profit the insurance company is making. Focus on the benefits of this scheme. But now, the people are very skeptical about NHIS.
Yes, they're very skeptical.
Could you alleviate their fears, please?
That is actually the advocacy that is needed by NHIS, by Ministry of Health, by everybody. Whether we like it or not,
Yes.
we need to receive care when we are healed.
Yeah.
If we don't pay out of pocket, what is the other option? How many of us will have that money kept somewhere?
Yes.
That if I'm healed tomorrow, I will just go there and remove the money. It's not likely that we'll have that.
Okay, why you're laughing at one tweet?
He says, when they sell their plan, their amounts are sugary, but to deliver the goods is a problem. NHIS call, NHIS.
No, but that's the
No,
thing.
we-
But the truth of the matter is, I'm sure that there are some people too that have good experience
So
about
I am
this.
going to I'm going to go to NHIS.
Please try it.
I'll go and try to apply.
Yes.
And I'll give you feedback.
I even want to do for some of my staff as well, to see if it really works.
Working, yeah.
Yes, it's working. It's not that
And
if
if
it
it
really
works,
works.
I will
It
tell
And
is
if it's not working, you trust me.
I'm beside you.
go shout me.
Please shout very well. I'm sure that it's working, and that's why I give you the word.
You're really bad.
But please, I need
Yeah.
to tell everyone it's important that we get health insurance
Yeah.
because
Yes.
you don't know what can happen tomorrow.
In
Let's
this
not
season of kidney, everybody around us having
so
kidney
many
or-
kidney issues, accidents, so many things.
That's all we can take on the show today. Don't forget, we're still on our road to size 10. For those of us joining us, we're going to the gym again today. We're eating healthy. We had watermelon this morning. What did you have this morning?
I had smoothie
This morning. So we're
Don't
having
forget the
salad for
groundnut
lunch.
too. I saw you people eating groundnut too.
We have sauce on groundnuts here, but we'll go there again. All right, so we're having salad for lunch and moment for dinner. So that's all. All right, you can catch us on YouTube/TV Entertainment and search for Yourview. You can also check us on Google Plus and search for TV Entertainment. Thanks for watching. Thank you so much, Doctor. We appreciate you.
Thank you very much.
I hope you had a great time. I hope
Yeah,
you didn't intimidate you too much, eh?
No, no,
I
no,
tried,
no,
eh?
no,
Okay,
no,
all right.
no.
God bless you. See you tomorrow.
See you at 9.